You might go from speaking to somebody who's seriously considering taking their own life.
Owen is a mental health nurse.
Or we can try and help them and give them access to services that can support around their mental health.
With police officer Paul, they travel through the streets of Liverpool visiting those who are experiencing poor mental health.
It's just about speaking to people with respect. And he might experience mental health crisis, or he might be in some sort of mental health episode, so that I always think, that we should always deal with people correctly, no matter what.
You have reached your destination.
Working in coalition, they say, helps prevent hospital admission. If Paul was alone, he may have to spend time with someone in A&E or put them in a cell to keep them safe. Under Section 136 of the Mental Health Act, police can detain someone who is thought to be mentally vulnerable. But having Owen here, they argue, means they're able to access health records, give medical advice, and make referrals to support groups and others.
There's individuals who will fall through the net of social care and of mental health services. There's only a finite resource to go around what seems to be an unending number of people and an increasing number of people. Having services work smarter and work more collaboratively together is the only way that I can see that we can tackle situations like that.
FOI data obtained by Newsnight shows that 21 forces recorded a significant increase in mental health incidents over the last 5 years. Here in Merseyside, there's been a nearly fourfold increase, with police attending more than 7,500 incidents in 2017 to 28,000 last year. It's not clear how the data was collected by individual forces and whether the definition of mental health differed between them or changed during that time. A few hours into the shift, the team is alerted to a case involving a man in his 50s in the centre of Liverpool.
It's late afternoon and we've just pulled up outside a house. We're about to go and see a veteran who has been in contact with the police on several occasions before, talking about wanting to take his own life. So we're going to go inside and see if he's okay.
After making sure he was comfortable with us being there, we went in.
Are you okay?
Yeah. I'm a soldier. 21 years. RAF. I don't know how to save my life. I rang my mate, he rings me twice a week, right, yeah, and so does Gary, right, ex-armed forces. Anyway, I said, Mike, you know what, I'm troubled. I think I've been in prison about 8 times. I think I've been to court about 53 times. No one cares, love. No one cares.
Calling 999 for people like Paul is often the first resort when seeking help. In recent months, senior officers from other forces have spoken out about how they feel they're spending too much time on cases like this one instead of focusing on crime.
How does calling Paul and Owen help you?
It keeps me alive. That's all I got.
Right, okay, thanks, Paul. Take care.
By the way.
Thanks, Paul, man. There you go.
Back in the van, I ask police officer Paul how he feels about mental health work.
I suppose in an ideal world, I suppose the police wouldn't have to go to them sort of type of incidents, but unfortunately, because the chap is ringing up 999 or he's ringing up at 101, it warrants sometimes the police having to be sort of deployed to that sort of address. Previously, in mental health now, it's on the up and up every single year going on.
It's believed between 20 and 40% of police time is spent dealing with mental health related calls and incidents. As far back as 2018, a report by His Majesty's Inspectorate of Constabulary and Fire and Rescue Services said We have significant concerns about whether the police should be involved in responding to mental health problems. To the degree that they are, the police need to be clearer about the extent of this problem. Mental health cases are not the thrust of police work. That's dealing with criminality. Officers can feel a sense of frustration when they're asked to pick up the pieces from a stretched NHS. And for victims, it can feel like they're being criminalised for having health problems.
I've never felt pain like it. It was agony.
When John Kennedy posted suicidal feelings online, concerned friends rang 999. The police were sent round for a welfare check. The situation escalated.
I heard 3 loud pops from my arm, and I couldn't speak because my face was face down.
He brought a civil claim against Merseyside Police. A jury found that on a balance of probability, he'd been assaulted, falsely imprisoned and maliciously prosecuted by the police. In the end, they paid him £50,000 in damages. We asked him whether he thinks the police are the right people to respond to mental health emergencies.
Well, I don't think a mental health nurse would have broken my arm to begin with, would they? They would be more caring and passionate sort of thing with mental health. They just know how to deal with it. Police aren't really trained.
Despite the judgment in the civil case, Merseyside Police said it had investigated a complaint about the conduct of its officers and it wasn't upheld. It said no further action had been taken.
I used to be a social person. I don't really go out no more. Sometimes I hear police sirens and I go into a panic. It's like changed my life in ways that you wouldn't want to change. Why should you live in fear of the police?
The Home Office says to free up police time, a new approach is being developed which will make it easier for staff in police control rooms to identify the right agency to deploy at the outset when responding to 999 calls concerning people in a mental health crisis. But the Superintendents Association says the success of these projects is dependent on investment in other public services, such as health and social care.
I suppose the ideal outcome for the service users is that they don't necessarily need to go into hospital.
Owen told us that a decade of what he called underfunded public services had led to worse mental health among the poorest in Liverpool. The government says investment announced last month will help to improve the places available for people experiencing mental health problems.
After 300 yards, cross the road.
Paul and Owen feel working together is effective, where enforcement and empathy meet to save lives.
Paul's case, as difficult as it is, unfortunately, he's not an isolated case. There's a lot of people like Paul in the community.